Macular dystrophy is a chronic degenerative or dystrophic disease of the retina. There are two stages of macular dystrophy. The dry form, which is, let's say, more favorable. It progresses over a long period, often many years, and can gradually lead to a decrease in vision. Patients in the early stages of macular dystrophy may notice, let's say they may not have any complaints about vision deterioration at all, and at this stage, regular monitoring of the patient is sufficient. However, over time, this disease progresses. The complaints may also, again, progress, such as worsening vision, the appearance of distortions in the visual field, or when looking at certain objects. When reading, letters may appear warped, lines may become distorted, and this can already alert the patient and prompt them to see an ophthalmologist. And thus, the ophthalmologist, during dynamic observation, if they have seen this patient before, can already, so to speak, determine the progression of this disease. If over time the dry form progresses to the second stage, to the second form, which is the exudative or wet form, let's say a less favorable course, then the patient's complaints change significantly. As I mentioned earlier, a dark or blurry spot typically appears right in the center of your vision, which can vary in intensity and size, and as a result, the ability to read or write is often significantly reduced or even lost entirely. In the dry form of macular dystrophy, drusen can be seen on the fundus of the patient's eye. These are the byproducts of cell metabolism that accumulate in the retina. These drusen can be solitary, or they can merge, forming larger drusen or so-called giant drusen. If they are located paracentrally, they may only slightly reduce vision. If the drusen are located directly in the fovea, in the very central zone, then of course vision can be significantly reduced and distortions may also appear. That is, straight lines become distorted, letters appear doubled, lines of text appear doubled, all of which increases the patient's discomfort in daily life. So what happens in the exudative form? Retinal ischemia occurs. In response to retinal ischemia, the body begins to release factors that stimulate the growth of new blood vessels. That is, the body tries to compensate for the lack of blood supply by growing new blood vessels. However, unfortunately, this growth is uncontrolled. These vessels are deficient, and instead of 3 walls as in normal vessels, these have only 1 wall, which contributes to the rapid leakage of blood plasma through these walls, as well as blood cells, which can lead to hemorrhages in the retina. All these symptoms are characteristic of the exudative form of macular dystrophy. Unfortunately, patients do not always consult an ophthalmologist at the early stages of the disease. However, if they do, a certain set of diagnostic methods is required. This includes vision testing, mandatory pupil dilation, and ophthalmoscopy of the fundus. If a preliminary diagnosis of macular dystrophy, specifically the dry form, is established, then a number of additional diagnostic methods are performed, such as optical coherence tomography and fluorescein angiography for differential diagnosis and clarification of the diagnosis. If the diagnosis of dry form macular dystrophy is confirmed, then at this stage dynamic observation is necessary. That is, the use of vitamins rich in carotenoids and essential elements, adherence to a proper diet, and giving up bad habits. And most importantly, I repeat, is dynamic observation. The patient needs to visit an ophthalmologist every 3, 4, or 5 months in order to monitor the retina, check visual acuity, perform optical coherence tomography again, and observe the progression of the disease. Because, as I already mentioned, the dry form can progress to the exudative form, and then the symptoms are completely different, as is the treatment. As for patients with the exudative form, as a rule, the vast majority of these patients seek help only at the later stages of the disease.